Welcome to my short introduction, Living with Long COVID. My name is Jenna Hopkins. I've got master's degrees in education and occupational therapy, and I've been the primary occupational therapist working with the Long COVID clinic since early 2021. I'm a member of the Long COVID Physio Disability and Safe Rehabilitation Committee as well. While it's been a privilege to work with so many people with long COVID, one of the primary obstacles has been a lack of simple and good information. People don't really understand long COVID and how it aligns with other conditions. Early access to the correct information and lifestyle management tips is essential. So if you're interested in this information, I have free information available on my YouTube channel at TouchTree Life and also on my website, touchtreelife.com. I know that working with the right rehabilitation specialist is the gold standard, but there's a lot of roadblocks to obtaining this kind of care. So let's get started. COVID-19 weaves a path of disaster and destruction, and while some suffer immediate harm, others embark on a long and arduous journey due to long COVID. Long COVID affects 6 to 45% of people who get COVID. It can affect anyone exposed to SARS-CoV-2, regardless of age or severity of original symptoms. There's over 200 symptoms associated with long COVID. The most common are fatigue, brain fog, anxiety, depression, difficulty breathing, heart palpitations, and an inability to tolerate activities you could previously tolerate. The truth is, you might have none of those symptoms and you still might have long COVID. Right now, anytime you get COVID, it's a roll of the dice as to whether or not you develop long COVID. And the more often you catch COVID, the more likely you are to experience it due to complications across various organ systems. So we need to figure out how to manage symptoms and avoid new and worsening symptoms immediately. So one of the best things you can do is try and avoid reinfection. What are you willing to do? Are you willing to wear a respirator mask that covers your nose and mouth in public settings? Are you willing to use nasal sprays, nasal rinses, mouthwashes after exposures? Are you willing to reduce in-person interactions or maintain social distancing? Are you willing to change to distance learning or work from home as able? Are you willing to use order pickup or drive-through services? Are you willing to get vaccinated and receive booster shots as recommended? Wash your hands frequently, avoid touching your face, disinfect surfaces. Work on the ventilation of your indoor areas and use HEPA filters. Are you willing to minimize non-essential travel? And then lastly, if you have symptoms of COVID-19, such as fever, cough, shortness of breath, loss of taste or smell, and fatigue, please test immediately. In the USA, you can go to covid.gov and you're eligible to order free at-home tests. Early testing is key to early treatment. There are also some additional preventative strategies if you are infected with COVID. The prevention of long COVID isn't guaranteed, but certain measures may potentially reduce the risk. These tips are also the first things to do in the early stages of long COVID to prevent worsening symptoms. So before you get exposed, I prefer you visit your doctor and make sure any underlying health conditions are really well managed, because those can increase the risk of severe outcomes in long COVID. Request vitamin D, B12, and iron studies to make sure you don't have nutritional deficiencies. And then discuss a plan with your doctor for what to do if you do get a positive test. Include planned use of medications and supplements. Then if you do test positive for COVID, make sure you seek early medical attention. Even delays of a few days make a big difference. Monoclonal antibodies have been shown effective in preventing worsening COVID. Antiviral treatments like Paxlovid or some antiviral cocktails may lessen the effects and reduce the risk of long COVID. And metformin, a type 2 diabetes medication, has demonstrated a 40% reduction in the risk of long COVID. You can also explore some new treatment options like nitric oxide and antiviral nasal sprays. For supplements, I recommend going to c19early.org, and they have real-time meta-analyses and study links with supplements that might be helpful with long COVID. High quality supplements like quercetin, nattokinase, Nigella sativa, melatonin, curcumin, vitamin A, vitamin D, methyl B12, and zinc are all linked to greater than 25% improvement in single-use studies. Also, C19early.org tells you to avoid acetaminophen, that's Tylenol, CBD products, and vitamin B9 or folic acid when you're COVID positive, as they might be detrimental or ineffective. Then when you are COVID positive, consider using H1H2 antihistamines. Pepcid or famotidine is the most well-known. And then any antihistamine of your choice, that might be Zyrtec, Allegra, Claritin. And those can offer protection against inflammation and mast cell activation after COVID infection. Make sure you're maximizing your hydration, prioritizing sleep, and consuming nutritious food during and after infection. Then gradually return to your activity. So it would be good if you tracked your morning resting heart rate and heart rate variability to ensure you're recovering from your activities from the day before. Visible Long COVID has a free app which helps to track this if you don't have a good fitness tracker. Keep performing daily activities to tolerance, but avoid traditional exercise for about 6 weeks post-infection. You want to try and keep your heart rate low, under about 100 beats per minute most of the day. Try and avoid physical and mental stressors, and then gradually return to physical activity after about 6 weeks of being symptom-free. Then immediately stop exercise if you experience symptoms like atypical shortness of breath, chest pain, dizziness, or fatigue, and follow up with a long COVID clinic or with your primary care doctor. Getting started on the road. If you do start to have long COVID symptoms, make sure you gather a support system immediately. The road to recovery can be long and challenging. Involve your family and friends so they know how to support you, share resources, limit time with anybody that's not interested in your mental and physical well-being, and find medical professionals that are familiar with this. Long COVID, ME/CFS, POTS, dysautonomia, and Ehlers-Danlos syndrome are all complex conditions that need specialized and holistic care. So you're going to involve multiple people in your treatment plan, including therapists, nutritionists, cardiologists, primary care, maybe even acupuncture and psychology. This road isn't meant to be traveled alone. So the most important thing to understand is that long COVID is just not one thing. There are symptom clusters. So long COVID requires tailored treatments based on your specific symptom clusters. It's crucial to understand your symptom patterns and ensure that your treatment is targeted towards the clusters that you exhibit. So what we want to know is, do you have post-exertional malaise? Do you have hypermobility? Do you have mast cell disorder? Do you have dysautonomia? And do you have mental health, sleep, and breathing disorders? About 75% of people with long COVID have post-exertional malaise, and this needs to be controlled right away, or it can turn into chronic fatigue syndrome. Hypermobility, what we're noticing is that a lot of people that have long COVID have increased hypermobility. About a third of the people I see can be diagnosed as hypermobile spectrum disorder. This is up and coming research, so I can't tell you why exactly people that are hypermobile tend to get long COVID. Next up is mast cell disorders, and this can turn into mast cell activation syndrome. Again, we see a very large symptom overlap with long COVID, and the association has been made clear, but I'm not exactly sure how many people with long COVID have mast cell issues. Next up, about 60% of people have dysautonomia. Most of those tend to fall in the POTS category. So with POTS, think the Tin Man. And then mental health, sleep, and breathing disorders are last. That's our lion. And because so many of the other concepts have to do with things that feel a lot like anxiety and feel a lot like depression, we really need to make sure everything else is screened before you start to treat for anything else. So first up, we've got post-exertional malaise. With post-exertional malaise, this is the Wicked Witch of the East. You feel like a house fell on you. If a house is currently on top of you, then it is impossible to get up and walk down the road. This has to be resolved and controlled first. It's characterized by fatigue that doesn't get better with rest, and symptoms can get worse after physical or cognitive activities. So it's defined as central fatigue, which means that anything you use your brain for can wear you out. So people get stuck in this push-crash cycle where they do something that they could previously tolerate. It could be laundry or vacuuming, and that causes a symptom flare-up. The symptom flare can be delayed 12 to 48 hours after you did it. Then you rest, then those symptoms go down, and then you're frustrated because you feel like you can't do anything, and then you start to do an activity again and you overdo it. This is a downward spiral. We need people out of this push-crash cycle immediately. I've got a whole mini series on YouTube about this, post-exertional malaise and how to control it. The diagnostic that a lot of people use is the DPAL symptom questionnaire. And again, that's on my YouTube video. Next up, we've got hypermobility and EDS. The reason it's important to know is if you have this is if you are a Dorothy, if you are hypermobile or have a connective tissue disorder, then you basically are automatically have to include all the other symptom clusters. So you're not only a Dorothy, but you're also automatically a lion, a tin man, and a scarecrow. All of those characters have to be walking the right way down the road together, or that's going to interfere with your recovery. Okay, I chose Dorothy for EDS and hypermobility, but really, these are my zebras. Next up is mast cell disorders. One of the things you have to know is, do I feel better if I take antihistamines or if I do a low histamine diet? If so, if you have, for example, exercise-induced asthma or allergies, it could be that you fall into this category. There's some medications that can flare this up. And then this can also interfere with your activity tolerance. So it's really important to know if this is a symptom cluster that you have, because it's going to change your treatment plan. Next up, we've got dysautonomia and heart conditions. So with this one, we need to double check and make sure that you are able to stand up without your heart having to work extra hard or your blood pressure falling. So I prefer people do an active stand test. The information is right here. You are able to do this at home, or you can take it to medical professionals to have it done. You do need to have a high quality blood pressure cuff that goes onto your arm and not just your wrist. And then I also have the diagnostic criteria here. Then we've got our breathing disorders, sleeping disorders, and mental health. Across the board, breathing and mental health conditions like anxiety and depression are up 30%, but especially so for long COVID, because we have so many things that are increasing our sympathetic nervous system. So if you aren't breathing well and you aren't sleeping well, then you are going to be having mental health issues. And this is very, very typical and common in long COVID. So assess as many of these things, doing a sleep study, doing breathing screens, working with somebody that does breath retraining, that can be very helpful. And there's guidelines out for therapists as well in terms of medication management. If you don't fit into any of these categories, it isn't because you don't have long COVID, it's because you are probably having a generalized inflammatory response. So it can wreak havoc on people's immune system. So you might just be getting sick a lot more often, or you might be having inflammatory responses in certain parts of your body. We know it causes changes in people's brains, and we know it causes changes in people's cardiovascular system. So if you don't fit into the other categories, you want to basically treat the inflammation as best you can. That's going to be through diet and through medication uses. The only way that this really isn't like the Wizard of Oz is the fact that you can't just tap your shoes and go home. You have to go on this complex journey together. You have to figure out which of these symptom clusters that you are and make sure you're all walking down the path the right way. It is very complex, and that's why I wanted everybody to know at least about the symptom clusters. I have much more information available, but I'm trying to keep it as simple as possible for this introduction. I will post additional videos on each symptom cluster and how to best manage it. Thank you so much.